then I skipped a period and I started having hot flushes. And then finally I had the hot flushes. I knew that this is not quite right. So I started running the functional medicine tests for me. I have access to it, so I could do it really every single month. And why every single month? Because when I went to the doctor and they did the serum test, at that time I was just before the menstrual cycle. And so all my hormones looked normal. And the doctor said it's all normal. But then when I skipped the period, and for example, for 30, 40 days, I didn't have the period. Actually, the symptoms came back. So I knew I had to test it every time in this critical timing. And yes, then it revealed that I didn't have sufficient amount of progesterone and I had very small amount of estrogen, which is made in the belly fat. And that was another sign. So as you can see, I don't carry too much fat and I'm quite built in muscle. But I started growing these love handles and belly fat. It was because my body was trying to protect me, because fat is the endocrine organ. With the enzyme aromatase, it can actually create estrogen. So estrogen is not as potent as estradiol, but my body was trying to make me survive because it knew I need some source of estrogen, and hence this belly fat. So if these are the signs for you, you know that you might be perimenopausal as well. So thanks to my functional medicine studies and nutritional therapy and all the books, I was able to self-diagnose and then self-treat with bioidentical hormones. And I will talk about it later, how I made a choice, because I want to ease the transmission. And this is also my mission for every woman to make this decision. So what are the signs of perimenopause? Very often it starts with some slight changes in a period. And this might not be happening every single month. It can be once every 6 months. You have a longer or shorter period, and it may be heavier or it may be lighter. Usually, it starts with the shorter cycle, so that's less than 25 days. Or you might skip a cycle. So I also did not mention to you that when I went to the gynecologist and I asked her to do the scan, she noticed that my left ovary didn't have follicles. My right ovary had the follicles. So it was only my right ovary that was ovulating, not the left one, and hence the hormonal imbalance. You might also notice sore or swollen or lumpy breast. And this is very typical for low progesterone, because the perimenopause starts with the low progesterone and then higher levels of estrogen. So as you are going to learn, estrogen is a builder, and we have receptors in the breast for estrogen. So it grows. Your breast might get bigger, swollen, painful. It might be also lack of iodine and thyroid problem, because all the hormones in the body are connected. You might notice that you have this premenstrual syndrome and maybe menstrual migraines or headaches that were not present before, and now they are manifesting. So these are the typical signs of perimenopause, as well as hot flushes, night sweats. But believe not every woman will experience hot flushes and night sweats. Only 80% of the women. The other 20% will notice other signs and symptoms. So mood swings, anxiety, depression. There's this change of how you feel despite no significant changes in your life. It's the same job, same husband, same routine, yet you are not feeling like yourself. And the visceral fat. So visceral fat, it's around the organs. It's not the fat that you can grab like on your legs or maybe your arms. It's the body fat. Maybe also noticed recurrent urinary tract infections or yeast like candida. So every time when you get intimate with your partner or playing with yourself, you notice the irritation. Because if you have low levels of estrogen, it's also going to change the vaginal microbiota. The next stage is vaginal dryness. And this is usually a combination of low estrogen and low testosterone. So the masculine hormone, but every woman has a testosterone as well. And hair loss. So this might be because of higher testosterone and lower estrogen. And so the only way to see where you are exactly is with the urinary metabolite test. Cellulite, less muscle mass, and body odor. So it's usually under the right armpit, and the smell from the cortisol, because cortisol is high, and also the extremely high levels of estrogen dominance, it's like a leak onion, and sometimes it can be smell of the sulfur. And notice it's only the right armpit, not the left one, because the right one is close to the liver. Liver doesn't know how to handle with it, and it's sending it like this, detoxifying. So what are the less obvious signs of perimenopause? I highlighted tinnitus and frozen shoulder, because these two I see quite often with my clients. So tinnitus is the ringing in the ear. It can be also dry mouth, dry eyes, and skin. Why? Because if you have low levels of estrogen, estrogen is a mucus builder. So vaginal dryness, dry eyes, dry skin, dry mouth is because the estrogen is not building the moisture and the mucin. And you might also experience constipation, because we also have mucus in the intestinal lining, and this declines as well. Burning sensation in the mouth, that happened as well. Dizzy spells and vertigo. This can be dysregulation of the other hormones like aldosterone that is responsible for the sodium and potassium balance. But when you are under stress, and this is not psychological stress, this is the chemical stress that is happening in your body, it might shift the steroid pathway and create more cortisol, and then you might have these dizzy spells and vertigo. Tingling in the extremities. It can be restless leg. When you are lying in the evening, in the night, you might feel it's almost like a cramp, but not cramp. You have a sensation you want to move the legs. That can be a hormonal imbalance. And of course, heart palpitation, this happens very often, and this is mostly with the estrogen dominance. Chronic fatigue syndrome, you are tired no matter what, because your sleep is disturbed because of high cortisol, because of insulin resistance, and low-grade inflammation in the body. So what are hormones? So hormones are chemical messengers. And it's our brain, the CEO, that sends the signals. So as I will be sharing with you the blood test, you will see like what signals the CEO is sending to the ovaries what to do. But here I have a beautiful picture about the receptors. So what also happens that we are exposed to xenoestrogens. So these are toxins in the environment, in what we eat, what we drink in the water, what cosmetics we are using. So whatever you put on your skin, would you eat it? If not, these toxins act as hormones and they block the receptor. So you can see that this is the receptor. But if that place is blocked, your hormones that are produced cannot send the signal to the cell. So imagine, I have my mobile phone now. I switched it off, of course. So even if there are some messages, I cannot read them. And if, for example, somebody tells me now, Blanca, 5 people are coming for a snack to your house, please prepare something to eat. Well, I am not able to receive this message, and therefore I am not able to take the action, which might be disaster in a little while. And the same happens in the body. Or there is a different language. Well, if I receive the message in Japanese, I don't know what I'm supposed to do. So even though I receive the message, I'm just not going to act on it, or I will do something what I believe I am supposed to do. So this is misfiring hormones. And there can be some parts broken. So for example, hormones are made from fat, and they're also made from protein, and the same for the receptors. If you don't eat sufficient amount of the protein or fat, or you don't absorb it and digest it because you are under stress, you are in a vicious circle. And so you can see that it's not only about ovaries, it's a combination. So if you, for example, have hypothyroidism or Hashimoto or celiac disease, or you have any other inflammation in your body, like pathogens in your gut, you can see that the gut is going to send a signal to the brain, and the inflammation might have impact on adrenals, which are the stress hormones, cortisol, adrenaline, which is going to suppress the thyroid. But thyroid gives a permission to the ovaries to produce the follicle. It says, yes, I am ready. You can conceive. But if you are under stress, the body will say, no, this is not good time to conceive. And remember, the menstrual cycle is about the body potentially getting pregnant. So thyroid, when it's underactive, it's also going to act on insulin. So you might feel hungry all the time, and the insulin might be high. Insulin is creating inflammation. Liver needs to filter everything out, not only from the gut, but from the portal vein, from the systemic bloodstream. You might have leaky gut, and then all the pathogens are coming into the blood. So imagine, that's why in functional medicine, we are trying to find the root cause of the problems. So here is one example. So this is the thyroid. So what effect it has if you have low thyroid hormones, hypothyroidism. So your TSH is high or might be high, and the T3 and T4 are low, and maybe you have also increased antibodies, so Hashimoto. So you might notice that you lose your hair, you have puffy face, you have swollen eyelids, you might have hypotension, so you have low blood pressure. You feel like you would faint if you don't drink coffee or if you don't eat. You might have increased LDL, so this is the so-called bad cholesterol, but this is the carrier for the sex hormones. You might notice that you have swollen ankles or legs when you are standing for a longer time, or you feel like you are completely swollen. When you exercise, you have sore muscles for a long time, and you might have sore joints as well. You might be constipated, you might have gas, and this gas can be stinky gas, so it's caused by a higher methane, or it can be like noisy farts, so this is higher hydrogen. You might have low libido, you might have cold hands and feet, your brain doesn't work in an optimal way, you feel tired all the time, and when you want to exercise, you are out of breath. So I did not even mention everything like the dry skin and dry nails, but you see it. So sometimes you might be thinking, I am in perimenopause. It must be the estrogen and progesterone. But what if it is thyroid? So again, running the full panel of all these tests will help you to identify which endocrine organ is hypo, so working less, and what you can do about it. And now let's look at the menstrual cycle. So as you can see, the cycle in general takes 28 days. It's absolutely normal, 25 days, absolutely normal, 35 days, if this was always like this for you. And here we have 4 players. So we have here follicle stimulating hormone, FSH. We have luteinizing hormone, LH. And you can see that when the menses, the menstrual cycle starts, it is shedding the uterine lining, and then you start bleeding for 1, 2, 3, 4, 5, 6, 7 days. That is also absolutely normal. And at the time, you can see that the line, the green line of the follicle stimulating hormone, the first 7 days, it's like relatively low, and then it starts slowly coming up. So it is stimulating the growth of the follicle, hence follicle stimulating hormone. And so if you have sufficient ovarian reserve, the follicle will grow and grow and grow. And then around the ovulation, which is usually around day 14, this cover, the follicle will burst, and the egg is going to travel through the fallopian tubes into the uterus. And the remaining part will turn into the corpus luteum. And corpus luteum, in that part, becomes temporary endocrine gland, and it's going to produce progesterone. So you can also see that the brain, the CEO, is going to send a signal around the ovulation. So it peaks up and says, hey, start producing progesterone. And then both of these brain-stimulating hormones go down. And when we look on the ovarian hormones, so you can see that the estrogen, the orange line, was going up and up and up and up until the ovulation, and then it drops down. And progesterone that was created by the corpus luteum, the purple line, is going up and up and up and up, and then it drops down. So you can see on the bottom line, so we have follicular phase, we have luteal phase, and then it goes again from the start. What happens in the perimenopause is that you are having cycles, menstrual cycles, but they are anovulatory. You are not ovulating. There are no eggs. So this follicle might grow, might not, might burst, might not. But then, if the ovulation did not happen, if the follicle did not burst and did not grow, there's not going to be any corpus luteum. So from the blood tests, you will notice that the follicle stimulating hormone and luteinizing hormone are shouting. They're shouting, sending signals to the ovaries, make more. But the ovaries are not listening, or they would like to listen, but they just don't have the ovarian reserve. And so you will also notice that the progesterone levels are low. And that's the first sign of the perimenopause. Estrogen will be still created from the fat cells, but progesterone can only be made from the corpus luteum in a sufficient amount. There is going to be a very small amount made in the adrenal glands. So that's the first sign. Now, how can you know if you are ovulating or not? So I personally use Oura Ring, and Oura Ring is measuring the body temperature. So here I made a couple of screenshots that shows you that if the temperature is going up, you have progesterone and you were ovulating. Yeah? So you can see here it was low, and then it goes up, and then it goes down. So here I was always noting when I had the menstruation. So when I have the menstruation and the body is going to form estrogen, estrogen brings the temperature down. And if it goes very low, that is estrogen dominance. So you can see this was the estrogen dominance, then it's going down and down and down. So this is all the time estrogen dominance. And here you can notice that I got another period that was anovulatory because the progesterone did not go up. So I was just growing the estrogen up and up and up. And then suddenly it caught up again. So then I had a progesterone, and then I had an estrogen, and then I had a progesterone, and then I had a progesterone, and then I had very little estrogen. This is a typical roller coaster in perimenopause. What other tests I usually run? Functional medicine tests. It's either Dutch tests or the other one on the right side. This is from Regeneris. This is doctor's data. And both of them are brilliant. Both of them are similar price, and both of them give you similar data. And in this beautiful chart, I want to explain to you how it works. It's almost like a highway. So first of all, if you are, for example, having diarrhea and you are slim and you are not digesting properly and you are under stress, you're not going to have sufficient amount of cholesterol. So cholesterol is the building block of all steroid hormones. It's made out of cholesterol. So avoiding cholesterol is not a good idea. I always need to have a sufficient amount. And then you can see these numbers here. So these are enzymes. Very often I can see polymorphism. So it's genetic polymorphism that people are not able to produce this enzyme, and therefore they are not able to produce a sufficient amount of the hormones. And then we are looking at how we can help the body to work with this polymorphism. But look at it. So first step is in here, and then the body decides. So imagine it's like a bakery. So in a bakery, you will have flour. And it depends on the demand. So if somebody says, hey, we need baguettes, like progesterone, the body will create more progesterone from the raw material. But then it might not have enough for making cortisol or making testosterone. So if the body is under control, everything is in the balance, and there is like cyclical request for the products, the body will be able to cover all the requests. But if you are long-term under stress, chronic stress, and the body needs to make you survive, it's going to make cortisol, and this is called cortisol steal. So from the highway, it's always going to come to the cortisol, and you will not be able to create sufficient amounts either of testosterone, estradiol, which is needed for the pregnancy, and then broken down to estriol. And what it can also happen is that you might create some of these metabolites. So OH16 and OH4. OH4 is damaging the DNA, and OH16 has the most estrogenic potency. That's not what you want. The safest one is OH2. So this test, but even this test is showing here. So for example, OH2, you can see on the second picture, 7 to 9, and it's in the marker where it should be. However, this DNA damaging is slightly increased, and the most carcinogenic is luckily low. This also shows that here is a way too much of the estrone, so the most potent estrogen made either in the fat cells or as a result of stress. So estrone and estradiol, and it is not methylated, it is not broken down and eliminated from the body in a proper way. And the graph here, it also shows you the graph of the cortisol. So there are like 4 or 5 samples that you can take. So these tests are really nice because it shows you exactly where you are, what you are eliminating from the body, where is a block in the pathway, and then based on it, if you, for example, have too much of the 5-alpha reductase, which basically from the testosterone turns it into DHEA. So DHEA is 10 times more potent than testosterone. And so women who have PCOS, polycystic ovarian syndrome, they usually have high levels of androgen, and especially this DHT. So they are growing hair on their face, on their chest, on their breast, on their back, and they are losing hair on their face. And so when we know that this is happening, we are trying to block this alpha reductase and take it through the aromatase to make more estradiol. So these tests in functional medicine are very useful. But if you don't have access to functional medicine, or you do not want to invest into these tests, you can talk to your gynecologist. So here, take a pen and paper, because this might be interesting for you. So as I was showing you before, we have the follicle stimulating hormone and luteinizing hormone. So here you can see that, for example, here in January 2024, these markers were quite low, 3.8, compared to the next one, 73. So if you look at the range, menopause 26 to 133, here is menopause. So this marker already tells us that this person is in perimenopause or menopause. Here we have like another result. So this is luteinizing hormone, which I told you gets increased during ovulation. So here it was a healthy level, but let's say 27, it's already in the range. It might be in the range of ovulation and menopause. So it's very important. When do you do the test? So if you are still menstruating, you just notice there is a slight shift or maybe heavier period, and you have a 28-day cycle, you want to do it 7 days after the ovulation. So when we said that the ovulation is around the day 14 in a 28-day cycle, plus 7, because you want to do it in a luteal phase 7 days after the ovulation. So let's say that day 21 would be optimal for this person. If you have menstrual cycle every 35 days, then you must count that it might be day 27 or 28 for you when you want to test. If you did not have your menstrual cycle for 3 months, but you at least notice that there is some repetition, that it's every 3 months, you want to do it maybe in the middle of this cycle of your 3 months. And then we are checking the 17-beta estradiol. So estradiol is the most potent estrogen produced in the ovaries. So you can see that here in January 2024, it was 330. That is a normal level of estrogen. Even if it's in a luteal phase and even in a follicle phase, that would be acceptable. However, here, the second one, less than 24, the estradiol from the ovaries in that time is non-existent. And so you can see that in perimenopause, 1 month it can be like this and the next month like that. So you really need to test multiple times. Progesterone extremely low. So we know that there was an ovulation. And also notice the cortisol. You always want to test morning cortisol between 7 and 9 in the morning on an empty stomach, not eating anything, not doing heavy exercise before you do it. You just easily walk to the laboratory and see what is your cortisol. So you can see that here is the highest level. However, this depends on the laboratory. If you do it, this was done in France. If you do it in Switzerland, Switzerland has a very, very wide range, and it's like 870 is the upper level. So in their range, they will say this is normal. This is normal for corporate stressed people. In France, they would say, hey, this is high. You need to take a break. Yeah, so every country is different. Let me tell you that 535 in the morning is quite high. However, we don't want to have low cortisol because then it's a burnout, it's adrenal fatigue. So the approach will be to get the cortisol under control. So when we look at the endocrine hormones, so once more, if you are writing it down, you want to test the follicle stimulating hormone, luteinizing hormone, estradiol, progesterone, and preferably, if you are still menstruating woman, but actually even perimenopausal, you would want to look at the testosterone, prolactin, because if prolactin is high, this is typical in polycystic ovarian syndrome. It is suppressing the ovulation. And if the sex hormone binding globulin is very low, this is also in PCOS or hypothyroidism. So these are the ovaries, but I have another better picture for you. Yes. Once and forever, I want to explain to every woman how it goes and when you can get pregnant and when you cannot get pregnant. Of course, in perimenopause, it's very tricky because if you have your menstrual cycle every 2 months, 3 months, 4 months, you cannot predict. But if you still have a regular cycle and you are not taking any contraception, then the only time when you can get pregnant is when during the ovulation, the egg is released. So sperm can enter uterus in here, and then it can go into the fallopian tube. But the fallopian tube connects to the ovary only during the ovulation. Sperm cannot get or enter into the ovary. So here in the ovary, we have the eggs in the follicle. The follicle needs to burst. And when it bursts, then a fallopian tube will connect to it. And the egg that is released will live only 24 hours and will travel in the fallopian tube down. And it's going to send signals to the sperm. So the sperm will know where to go. Remember, you ovulate 1 month from right ovary and 1 month from the left ovary. Right, left, right, left. That's how it goes, okay? So when you go to the gynecologist, preferably for the examination, you want to go before the ovulation because you want to ask your doctor when they do the ultrasound, can you see from which ovary am I going to ovulate? They can measure the size of the follicle. Is it 16 millimeters? Is it 24 millimeters? How large is the follicle? And the gynecologist will tell you, this month you are going to ovulate from the right ovary and you are going to write down right ovary. And then you will always know, next month it's from the left ovary. And if it happens to you, what happened to me is that the left ovary doesn't have the ovarian reserve. And it's only the right ovary that every 60 days is going to ovulate. then I at least know, as a contraception, how to, for example, protect me. So the only time when you can get pregnant in these 24 hours is when the egg is traveling and it comes into the uterus and it might meet the sperm. And if it doesn't happen within 24 hours, the egg is going to die because it's a hostile environment, it's very acidic, and it's going to die. The sperm, of course, can wait and survive 48 hours, 72 hours in the vagina and in the uterus. So yes, you count maybe 2 days before the ovulation, 2 days after the ovulation. But if somebody tells me that they got pregnant 3 days before the period, that is not possible. The egg is not there. And if the egg is not there, even if the sperm is there, it's just half of the equation. I hope that you understand this. So as a menstrual cycle, as a contraception, I believe that symptothermal method works really well, or maybe copper IUD. These are the only two that I would recommend to my 15-year-old daughter. And nothing else. And on this picture, you can also see fibroids, you can see the endometriosis, and this is all caused by increased estrogen levels. Where to start? So you might be thinking, okay, so I'm just going to repair the sex hormones, estrogen, progesterone. It just doesn't work like this. If you want to open the safe, it has to go first through the adrenals, then the thyroid, and only then the sex hormones. So adrenal gland is producing cortisol, the stress hormone. So if you are under stress and it's psychological stress, which you cause to yourself by creating it yourself, by taking your illusion, which you turn into your reality, and you create fear and scarcity in your mindset, that's psychological. Mechanical, it's usually when you, for example, have fibroids, or you have any inflammation or any obstacle, sore knees, sore joints, broken muscle. This is like a mechanical stress. It's also going to create inflammation and cortisol. And then chemical. So chemical is perimenopause, menopause, any hormonal imbalance, because it has impact on our brain. So we have a vagus nerve. Vagus nerve is connected to every single organ in our body. And this hypothalamus, so the CEO, pituitary, that releases hormones, and adrenal, which is also producing the cortisol, and also estrogen and a little bit of progesterone, they are all connected. So starting with taking the stress under control is recommended. The second step is thyroid. So if you have family predisposition for hypothyroidism and you are going to your endocrinologist, maybe you are taking desiccated thyroid hormones, bioidentical T3, T4 in a combination, and that might be, in that case, the solution. In other ways, it's to provide the building blocks to the thyroid. So if you have noticed any of these symptoms, easy bruising, muscle pain, joint pain, weight gain, carbs craving, fatigue, dry skins, absence of sweating, low libido, fertility problems, get your thyroid hormones checked. TSH, which is the thyroid stimulating hormone, T4, T3, free, and also the antibodies to eliminate the potential Hashimoto autoimmune disease. So thyroid hormones is needed for the ovulation. Thyroid gives permission to the ovaries to ovulate and then create progesterone. So you can see how it is connected. Every time when you are going to have any of these hormonal imbalances, like high prolactin. Prolactin is normally a breastfeeding hormone. So high prolactin we have when we breastfeed, because we are protecting the body not to get pregnant again. Yeah, because we are taking care of a baby that we have. PCOS, polycystic ovarian syndrome. So this is very often insulin resistant, and then you are going to have very low progesterone because you have multiple follicles that create cysts, but none of them becomes dominant, and none of them bursts to release the egg and ovulate. Hair loss, dry skin, fluid retention, cold hands and feet, digestive issues, brain fog. We already looked at the picture before. You need to find the root cause of your problems and then act on it. But let's look, when we talk about perimenopause, about the king of the hormones, and that is estrogen. So that is a primary driver of the female reproduction. Without estrogen, we cannot grow the follicle. Without follicle, we cannot ovulate. Without ovulation, we cannot have babies or have progesterone. So it is a happy hormone. It's like a yang. It has a masculine energy. And maybe if you are a menstruating woman, you have noticed that after the menstruation, you actually have a lower appetite. You can do like running and you are thinking clearly because it's the estrogen superpower that helps you to improve the learning and memory, promote the skin collagen and elasticity, boost the serotonin and dopamine, these neurotransmitters that drive you to try new things and be bold. And it helps to prevent diabetes and blood glucose levels by suppressing the appetite and giving you the energy all day long. It also promotes the muscle and tissue growth. Yes, we know. So everything needs to be in balance because we want to have the estrogen and progesterone in balance. It's like a yin and yang. So progesterone is the feminine energy. And maybe you have noticed that after the ovulation, when the body is preparing for the potential pregnancy, you want to eat more carbs. Yes, progesterone makes us eat more carbohydrates and sweets. It might make you more introverted, more creative, living in your own world. It has a superpower as well. So it's thinning the uterine lining to ease the period flow. So when you have a sufficient amount of progesterone, the menstruation and the bleeding is very light and there is no premenstrual syndrome. It also prevents the breast cancer, boosts thyroid hormones, raises the body temperature, which we saw on the Aura Ring picture, reduces the inflammation, promotes the sleep and calms the nervous system. Yes, in a luteal phase, you sleep like a baby and protects you against heart disease. So now if you know that at the age of 35, when the perimenopause starts, and you might be experiencing an ovulatory cycle, you might also feel that you don't have sufficient amount of progesterone, you don't sleep well, and everything is more difficult. But let's also talk about the testosterone. You might be thinking about testosterone being a masculine hormone. When I was looking for the pictures in Canva, it was showing me all these pictures. So hopefully you enjoy this picture as well. So yes, in men, testosterone is responsible for aggressiveness, leadership behavior, muscle mass, ability to take risks, competitive behavior, physical and mental energy, libido, and desire. But so it is in women, but in lower amount. So we still, if we are in a leadership position, testosterone in that moment is going to help us to have the masculine energy and make a clear decisions and have the mental energy. And it also helps with the libido. So in bioidentical hormones, many women supplement also testosterone. I would personally say be careful because if you overdose it, you might notice this facial hair growth, weight gain, and insulin resistance. So everything in the body needs to be in an optimal level and under control. So how do you know if you are low in estrogen? So as we mentioned before, you will notice at least some of these symptoms: dry eyes, dry nose, dry vagina, chronically high cortisol, urinary tract infections, belly fat, mood swings, hot flushes, migraines, it's typical for migraines as well, and low libido. Well, how do you know if you have high estrogen? Well, if you have high estrogen, it might be water retention. You might feel swollen. You might notice you have fibroids or endometriosis, heavy periods, because the uterus lining is growing and it's building it even thicker than it should be. And then when it's shedding, there is more blood. We know that the estrogen receptors are everywhere in the body, but mostly in the breast. And so you might also notice this fibrocystic breast, and it increases the breast and ovarian cancer. In the last slide, I'm going to share with you some additional blood tests that you might ask your gynecologist to run if you have a family history of a breast cancer or ovarian cancer. But now let's look at men. So, are you low in testosterone? Well, every man would know this, because a healthy man, when in the morning wakes up and the cortisol goes up, the cortisol automatically increases testosterone. So a man experiences erectile, healthy erectile function. So basically erection. The erection is without any stimulus. This is absolutely normal in a healthy man with healthy high testosterone levels. I have many CEOs that come to me at the age of 50 and they say, look, I've noticed that now in the morning, I don't have the erection. And even if I try to stimulate myself, it's just not happening. And then when we run the blood test, we see that they have low DHEA and low testosterone and low sex hormone binding globulin. And we take the phytotherapy to improve this. With men who have more body fat, so is this abdominal obesity. So remember, the fat is an endocrine organ. And the enzyme aromatase is going to turn the fat into estrogen. And so men might notice this man boobs, so enlarged breast, but this is also one of the risks for the prostate cancer. So there is an enlarged prostate. So enlarged prostate then pushes into the urethra, and men feel like they need to urinate more often. So if you feel you experience something like this as a man, or you have a man at home that needs to go on a regular basis, urinate, and it might be even like a painful, and it's like a dripping, they cannot urinate properly. It might be due to the enlarged prostate, due to a low testosterone levels. And then of course, fatigue, muscle pain, poor memory, poor concentration, anxiety, depression, poor sleep, hyperglycemia, insulin resistance, infertility, and so on. So please run the tests. So now let's look at what can we do. So as you can see in the pyramid, we always want to start at the bottom. Modifiable lifestyle factors. Then we will look at the nutritional supplements and botanicals. And in the end, I'll tell you something about HRT. So the bioidentical hormone replacement therapy. So these modifiable lifestyle factors. So first thing, if you don't sleep well and you have high cortisol levels, you need to reduce caffeine. And reducing caffeine is to maybe 1 cup of coffee a day, and preferably in the morning, mid-morning, and nothing in the afternoon. Completely avoid alcohol if you are a woman and you have low estrogen levels, because it makes it even lower. Eliminate stress, that's what we said. So mindfulness, yoga, breathwork, and it's not the 30 minutes mindfulness in the morning. Mindfulness, yoga, and yoga, the union of the body and the mind, is 24/7. So every time you need to catch yourself when you have negative thoughts, and ask yourself what you can change about it, and if it's true and if it's illusion, and what are the negative beliefs. But we had many presentations on this topic before, and you will find it in many of my programs. Get rid of constipation. We need to eliminate the carcinogenic metabolites of the estrogen from the body. And unfortunately, there's one enzyme, when I run the stool test, we see it, beta-glucuronidase. And if this enzyme is high, it recirculates the carcinogenic metabolites back to the blood, it goes to the portal vein, it goes once more to the liver, it acts once more on the cells, and this can increase the risk of breast cancer and ovarian cancer. So you need to get rid of the constipation with healthy eating, which I'm going to show you, and with fiber and protein and magnesium every single evening. Reduce environmental stressors. So I showed you the picture of the xenoestrogen. So all these endocrine disruptors, all the chemicals from the food that were made by men, you want to eliminate them from the body. You can run a urinary test for heavy toxic metals and see what exactly you need to do. This is, again, functional medicine. Get rid of the belly fat. How? By getting the blood glucose levels under control, intermittent fasting, sleeping well, and so on. Let's go into details. So how can you manage the blood glucose levels? So this is low carbohydrate diet, time restricted eating like intermittent fasting, avoiding snacks in between the meals. So perimenopausal woman and definitely menopausal woman and andropausal man, 2 meals a day is absolutely sufficient. But if you are still having menstrual cycle, you are 30, 35 years old, you would want to have children, then you need to do a cyclical intermittent fasting. And I'm going to tell you about it in a little while. So here is the food that in general you want to have in your diet. Preferably broccoli, spinach, green beans, fish, meat, nuts, seeds, and then spices like cinnamon and apple cider vinegar that are helping to improve the insulin sensitivity. And then, of course, sport, sleep, and stress management. So how to increase estrogen? So first of all, what has impact on the estrogen levels? So ditch the low fat. In the previous slide, when I was showing you the steroid pathway, you know that cholesterol is the building block. So eating low-fat food is giving you less of the building block. And the same is for a low-caloric diet. If you are very skinny and you are restricting yourself, you are not giving your body the nutrients that it needs. What you want to do is you want to avoid anti-nutrients, allergens, and stimulants. So definitely sugar. I would say the omega-6, like these are sunflower seeds, and definitely wheat. So everything that has gluten and alcohol, coffee. And sometimes you need to be careful with beans because they have these anti-nutrients, lectins. What you want to include is anti-inflammatory food. So everything that you see on the picture, eggs, avocado, fish, chia seeds, flax seeds, I actually put here evening primrose oil. That's a brilliant one, or fish oil as well. You want some probiotics, kimchi, kefir, psyllium husk, which is like a soluble fiber that helps you to remove the constipation, green tea that improves the insulin sensitivity, turmeric, anti-inflammatory, ginger, pine bark, sage, licorice, and all these beautiful herbs. But what's the most important to say about the nutrition? It's every single day. It's not that you do it for 1 or 2 or 3 days. This is every single day. It's the discipline. And in a discipline, there is a freedom. So how can you decrease the estrogen? Again, it's everything that's brassica family. So it's cauliflower, Brussels sprouts, broccoli, everything that has sulfur, a cruciferous vegetable, berries, linseeds, chia seeds, tahini, so that is sesame seeds, nettle. Nettle is very good even for women with polycystic ovarian syndrome and estrogen dominance, and actually even for men. Nettle tea, fabulous. Yeah, and then psyllium husk again. We have here all the nuts and seeds, and definitely making sure you increase your B12 and B6 vitamins and vitamin D. Here I would recommend methylated form of the B12 and B6 and vitamin D in minimum 4,000 international units every single day, especially during the winter. And how to increase the testosterone? Well, this is more like for men than women, but it's improve the sleep, eat high protein breakfast. So 20 grams of protein is minimum, 40 grams would be perfect. And it has also tryptophan, so that will help with the sleep. Chicken, eggs, cheese, fish. It's mostly coming from the animal source. Increase physical activity, and then you can use branch chain amino acids. So these are like lysine and arginine and creatine and carnitine to help with the fat, turning it into the energy. And here are some of the supplements, but with supplements, it's very tricky because you need to know what you are actually targeting. I remember when I asked my mom, I said, look, I'm in perimenopause. I have these hot flashes and night sweats. And she said, oh, I was 47 and it started for me. And 30 years ago, my friend recommended red clover. This is the flower. And then within 3 months, it all disappeared. So I started taking red clover as well. It didn't work with me. I hope it will work with you. But if that doesn't work, bioidentical or hormones might be the solution. So how to do it with botanicals? So it depends which pathway you are targeting. So we are not going to go through absolutely everything, but I will give you some examples. So if you, for example, know that you have quite a lot of estrogen, and you know you are turning it into the DNA damaging metabolites, and you don't want that, in that case, grapefruit and hops might help to block this enzyme that was turning it this way. And you want to improve the methylation because you want the least estrogenic and least damaging 2OH. And in that case, you want to increase this pathway with the methylated B12, SAMe, magnesium, and B6. Yeah? So this is what you would do if you know that you have high estrogen, but maybe you have polycystic ovarian syndrome and you have too much testosterone and it never goes into the estradiol. So to make it to go into the estradiol, you would implement quercetin, vitamin C, nettle tea, and so on. And if you, for example, want to block it to go to DHEA because you are losing the hair, you might take flaxseed, saw palmetto, isoflavones, and flavonoids, probably in therapeutic doses. So it really depends what you are targeting. As a prevention, as a healthy woman and healthy man, you can just include all of that into the repertoire of food that you eat. But if you already have like a stage 4, the last stage of the perimenopause, you want to take it in therapeutic doses based on the results. So let's look at what you should eat. This is super easy. So these are the pictures of what I eat. Chocolate is there, definitely. It's magnesium. And everything is gluten-free. So this is gluten-free, protein pancakes. And I love sardines. And I love lots of vegetable and fermented food. So I practice what I preach. Everything that I told you that you should eat is in here. So how is it with protein? So 1 gram of protein for every kilo of the body weight. So if you have 60 kilos, you need minimum 60 grams of proteins per day. And so when we look at it, so for example, shrimps are quite high in protein. So this amount of shrimps would be most probably 15 to 20 grams of protein. And there is also the egg omelette. So each egg is 6 grams of protein. So it's 12 plus, let's say, 15. It's a sufficient amount of protein in the meal. The smoked salmon will be 20 grams of protein. Here we have 2 eggs and cheese. So this is 12 plus maybe 3, 4. So it doesn't really reach the minimum 20. But here, 2 pieces of salmon and maybe some yogurt and nuts. But overall, let's say I have 50 kilos, so I need to have 50 grams of protein per day. And that's what I always have. For menopausal women, it's double. So let's say that once I reach menopause, it will be 100 grams of protein for me. And it's going to be more difficult to do. And it will have to be done with some protein powders and most probably even more fish. Fat luckily is everywhere. So you don't really have to count fat because fat will be in eggs, in salmon, in cheese. Fat is luckily everywhere. Fiber, 20 to 30 grams of fiber. So if you eat sufficient amount of vegetable, for example, this bread is going to have large amount of fiber. And for example, these seeds, it's also quite a lot of fiber. Almonds, quite a lot of fiber as well. Salad, quite a lot of fiber. So fiber is everywhere. You need to hydrate. 40 milliliters of water for every kilo of the body weight. So if you have 60 kilos, 60 times 40 milliliters is 2,400 milliliters. 2.4 liters of water for a person that has 60 kilos. So calculate how many liters of water you need to drink every single day and eat the rainbow. It means eat different colors. Rainbow has violet and green and yellow and orange. I don't know what all the colors of the rainbow. This is just helping you that in there needs to be a variety of colors. And you can see in the pictures that I'm showing you per day, I definitely eat the variety of colors. And now we come back to the cyclical intermittent fasting. So if you are not menstruating anymore, you are in a perimenopause, you can do every single week 4-1. 4 times a week, you will be fasting for 16 hours. So not eating for 16 hours. You have a 8-hour feeding window with 2 meals. 2 times a week, you will fast for 18 hours or more. And you will still have probably 2 meals or 1 meal. It's up to you. And once a week, you will fast for 24 hours. So if you, for example, finish with your last meal the night before at 4 o'clock, the next day, your first meal will be at 4 o'clock in the afternoon. This is 24 hours. And if you are menstruating woman and want to, for example, conceive, you have to be very careful. You never want to fast and avoid carbohydrates in a luteal phase when you are growing the progesterone that is preparing the uterus for that pregnancy. You must eat carbohydrates and you must eat 3 meals a day. When you are in a first phase, follicular phase, you can try some intermittent fasting and do more exercise. So here are the golden rules of fasting. You break the fast always with protein. And then you take a 30 minutes break and then you can eat maybe something else. Hormone yoga therapy is absolutely brilliant. I recommend it. I'm a hormone yoga therapist. Yes, and why is it good? Because it's about the breath work. You can also stimulate the internal organs, the adrenals, thyroid, ovaries, and pituitary glands by breath work. For example, you can push the tip of the tongue to the soft palate, and you can engage the mula bandhas. So I have a full course on hormone yoga therapy. There is also a free preview. You can have a look. It will explain these 23 exercises. And if you, for example, know that you have a hypothyroidism, you maybe want to do the Ujjayi breath with the specific exercises to activate the thyroid gland. So these are all the benefits of the hormone yoga therapy. So we covered the modifiable lifestyle factors, nutritional supplementation, botanicals, and you might be wondering about the hormone replacement therapy. So for me, at the age of 45, still menstruating and still being in a perimenopause stage, in a functional medicine, it is absolutely allowed to start with the bioidentical hormones. So of course, I did my research before I decided for me to use. I wanted to know which one will I do. So I tell you what I knew that I wouldn't do. I wouldn't do the synthetic combined hormone replacement therapy when it's progestin, synthetic progesterone, combined with synthetic estrogen in one dose. Because in perimenopause, the hormones are still fluctuating. I'm checking my temperature, I'm checking all my data, I'm doing all the tests to know about microdosing. So I'm personally using estradiol bioidentical gel, and I put a little bit on my arm every single day. And this tiny bit that I am using, the first day I started using it, there were no hot flushes, no night sweat, and I slept like a baby. That's how fast it was. Within 1 week, all the other symptoms that I experienced, like I wasn't able to focus on reading, disappeared. Within 1 month, I'm exactly what I used to be when I was 25 or 30 years old. All my levels are stable exactly where I want them to be. So estradiol, bioidentical estradiol, absolutely saved my life. To protect my uterus, I'm also taking micronized progesterone, and I take a double dose because it helps me to sleep and it has a good impact on me. I went to the gynecologist. So first I tried, because I have a functional medicine doctors around me, I asked for the prescription, I showed them all my tests, and I tested it. I first tested estradiol and micronized progesterone on my own, and then I stopped it again. I did some other tests, and I went to the gynecologist, and I presented all the data. And I said what I want. I said which brand I want, which dose I want. I said everything that I want, and this is what I got as a 1-year prescription, and I can go to the pharmacy anytime, and it's covered by the insurance in every country in Europe, most probably everywhere. If you know what you want, if you provide the data, it works. I did many tests before I decided for the bioidentical hormones. So not only the serum, salivary, urinary, I did also DNA tests. In my family, we don't have anybody with the gene mutation. So I'm not really worried about the breast cancer and ovarian cancer. And here are other anti-tumor markers that I did not run for me, but I do it very often for my clients that came to me with a wrong synthetic hormone replacement therapy. And then unfortunately they had fibroids and they had to go through the surgery. So choosing your gynecologist, knowing what you want, and having a data is very important. But in my experience, every woman should have access to all these tests, all the results, and the decision to try bioidentical hormone replacement therapy. But it is not easy, especially in perimenopause. You really have to know what you do. I have a group of women, it's a program, it's called Happy Hormones, and every single Wednesday, I review all their data from the Oura Ring and everything that they do, and I give them my advice, and I always tell them to go back to the doctor if there is any bleeding or any signs and symptoms that shouldn't be there. Because after all, it's still hormones. So what have you learned today? By now, you know what are hormones, what are steroid hormones. You know what are the signs and symptoms of hormone balance. You wrote down all the tests that you can do and you know when to do them. You understand completely everything about the menstrual cycle. You have some simple science-based sustainable strategies for the modifiable lifestyle factors and maybe even some botanicals. So awareness is important, accepting that this passage to the new phase happens to all of us, and that taking action in advance, it's very important. Well, I have one offer for you. In exchange for a feedback and for a testimonial, so it's a visible testimonial with your name being seen on LinkedIn and other social media, I offer a 15-minute one-to-one session with me, where if you have any hormonal tests, I can review them, or if you have any private questions, I will answer them in these 15 minutes in exchange for the testimonial on LinkedIn. So if this is something that is interesting for you, you can see my email address below. You can send me an email. In a subject, you will say open to testimonial about perimenopause, and we can have a discussion. I hope you enjoyed. Thank you so much for your attention and hope to see you very soon.